Hey, peace and love, everyone. Welcome to this episode of the DJP. I hope that everyone had a spooky Halloween. Mine was fairly uneventful. I didn't do much, kind of hung out at the house. I did go to a Halloween party briefly. It was more of a recovery meeting than a Halloween party, though. So I don't know if that really counts or not, but I went anyway. You know, it was either that or just sit around by myself, and I didn't want to do that, so I took the opportunity and, stepped out of my comfort zone a little bit, because I don't really like parties very much. Never really been too much of a party guy. So, I went. Fuck it. Why not? Why not? Who cares? Anyway, on this episode of the DJP, my guest is Richard Capriola. Richard has been a mental health and substance abuse counselor for over 2 decades. It's a long fucking time. He recently retired from the Menninger Clinic in Houston, where he treated both adolescents and adults that were diagnosed with substance abuse disorders, and he's also the author of a book called The Addicted Child, A Parent's Guide to Adolescent Substance Abuse. And God knows that shit's rampant. Fucking kids are getting high at 8 years old now. They're smoking weed. They're probably freebasing fucking cocaine out of your fine china. I would assume. I mean, that's what... I'm sure that's what kids are doing. I know lots of stuff kids are doing, and I don't even want to talk about what I know that they're doing. So the things that I don't know, I definitely don't want to touch on or even venture a guess to, because that's just terrifying beyond the capacity for rational thought. What is wrong with fucking kids these days? I mean, we turned out fucked up. Our latchkey generation, if you were born in the 80s, chances are you're pretty fucked up. I know I am. I just wasn't integrated well. No one ever taught me how to cope. And I think nobody teaches kids how to cope because they don't know how to cope. Nobody knows what the fuck they're doing. Nobody knows what's going on. Everybody thinks somebody knows what's going on. Nobody knows. Nobody knows. It's just a mystery. Anyway, this is a pretty short episode. It's only 30 minutes long, about a 30-minute interview. So buckle up, hunker down, and be prepared for my subversive views on substance abuse and adolescence. Without further ado, Richard Capriola.
You might catch yourself sliding in and out of a hallucinatory state. Just relax and enjoy it. Just relax and enjoy it.
This is an experiment in mind formation. Information. Forming, controlling, operating your mind and your brain. Using digital techniques to overload, scramble, confuse, unfocus your mind. The natural state of the brain is chaos. Chaos is beautiful.
Hi, Justin.
Hey, Richard, how are you?
I'm doing great. How are you tonight?
Oh, man, can't complain.
Oh, that's good.
I mean, I'm sure I could find something to complain about if I wanted to, but that wouldn't be...
We could, I suppose.
wouldn't do much for me.
Yeah, right.
All right,
Thank you for taking the time to talk to me. I really appreciate it.
No, thank you for taking the time to talk with me, man. I really appreciate it.
Great. Glad to be here.
Absolutely. So let's talk about childhood addiction.
Okay.
That seems to be your forte.
Well, I've worked in it for quite a while and wrote this book for parents called The Addicted Child, A Parent's Guide to Adolescent Substance Abuse, after having worked for over a decade at Menninger Clinic in Houston, Texas, where I treated both adolescents and adults who had mental health and substance abuse disorders.
Did you see a particular large correlation between mental health issues and substance abuse problems?
I did, because, where I worked, it was a psychiatric hospital. So the teenagers that were coming into the hospital many times did have an underlying mental health issue that they were struggling with, as well as a substance abuse issue. That's not to say that every child has that, but for some, it can be some type of anxiety, depression, trauma, personality, or emerging personality disorder. Right. So it could be there.
Yeah, I've noticed, at least in my experience, I'm a recovering addict myself, and have had addiction problems pretty much since adolescence, I would say. Yeah. I'm in recovery now, so
great, congratulations.
Thank you. It's been a bumpy road, but here we are. Anyway.
Well,
So yeah, and I've been diagnosed bipolar. I don't know so much that I really necessarily would agree with the diagnosis. I think it's just all a matter of perspective. At least for me. I mean, that's not saying that there are not people that definitely have these diagnoses and have a chemical imbalance of some sort that has led to these diagnoses. I just think in my case, I just had an inability to cope with life.
yeah.
You know what I mean?
And I think that's a good way of putting it for a lot of people, just the inability or the struggle to cope with life.
Right.
Maybe it's an intolerable feeling. Maybe it's an intolerable thought. Maybe it's an intolerable emotion, but something we don't like having.
Yeah, like I said, I just think I had an inability to cope with life.
Yeah, I think that's very common. I think when you boil it down to the basics like that, I think there are a lot of people who struggle with that very issue. Maybe it's a memory, maybe it's a thought, maybe it's a feeling, but it's something that's very, very uncomfortable. And like anybody else, when we have those feelings, we don't like to just sit with them. We want to get rid of them. And for some, that getting rid of them, the solution can involve taking a substance. Maybe it's alcohol, maybe it's marijuana, maybe it's some other drug, but
Right.
we find out that works.
Right. Yeah, that's definitely my case. I mean, like to the T. I just, because of the inability to cope, I turned to substances to alter my reality.
Yeah.
And it wasn't until I really got involved with studying the Dharma, and I'm kind of a Dharma practitioner. But and that's basically all that is really learning to sit with your emotions and sit with it and deal with it.
and that's very difficult for most of us to do.
Oh, it's a learned thing. Trust me, it was not easy for me at first, and it's still a struggle sometimes. I don't ever really think about using anymore. Yeah. That's never a solution for me anymore. No,
it's learning and practicing, learning and practicing, and then it gets easier.
Yeah, exactly. It gets easier. It never gets easy. But it gets easier.
Easier. Yeah.
Yeah. So that's what worked for me was just, really that's what worked for me was a dedicated meditation practice and learning to sit with those feelings and emotions that I used to just run from.
Yeah.
Really just deal with as they say in the 12-step programs, deal with life on life's terms. It's like, this is just how it is right now.
Or another way of putting it is, being in the moment. Just being in the moment, which can be very uncomfortable for a lot of people, but takes practice.
Right. Yeah. That's a very large part of the Dharma is mindfulness.
Yeah. Yeah.
Which is very popular these days. Everybody loves to bandy that term around now, but it's something that's been around for quite a while, and it does work. It does work.
It does work if you're willing to practice it and you have the patience to practice it.
Right.
I think it's as you already know, it's a great coping skill.
Yeah, definitely. So you said you worked in Houston?
Yes, I worked at Menninger Clinic, which is a large psychiatric hospital located in Houston, Texas, that serves both adolescents and adults from around the world. I worked there for a little over a decade, treating adolescents and adults diagnosed with a substance use disorder.
Mm. So, walk me through a day, like a typical day at work. How many patients would you see, and I'm just curious.
Yeah, I mean, a patient would be admitted to the hospital. Because they're adolescents, they would come with their family. Right. Just about all of them were yelling and screaming and arguing and bargaining and didn't want to be there, so they were angry.
Yeah.
But they would come in. We'd get them on the unit. They'd get them settled in. Social workers would spend time with the family getting a psychosocial evaluation. Eventually, I would meet with the young man or young woman and get a comprehensive assessment done with them. Do some testing, find out what drugs they were using, how young were they when they started, how often they were using, what was their motivation, did they want to quit, did they not want to quit? And then I would also engage in individual counseling with them and then do some group work with them. So they were involved in both individual counseling with me for addictions, and I also ran some addiction groups there during the week. There would be 2 or 3 groups a week, and I would usually meet with the young men and women once or twice a week individually.
I mean, what is the solution to learning to cope with life, basically? Because I think that ultimately that's really what most, unless they maybe they were injured on a job and then then we're talking about adolescents, so that's not even going to be the case. So we're talking about kids that are just unable to cope with life, and I think it's really because they're never taught how to.
I think that's exactly right. They've never been taught the skills on how to deal with intolerable thoughts or intolerable feelings like anxiety or anger or whatever they're feeling that they don't like.
Right.
They've never been taught the skills on how to deal with those. So not having the skills, they look for a quick fix. Adults do too. They look for a quick fix. We want things to get fixed right now.
Right.
And unfortunately, and many times what the kids find is the quick fix is through a substance.
Right.
Maybe they picked it up on the street. Maybe they've got an idea from another friend. Maybe another peer suggested they try it. But I think the solution to this as an alternative is we need to do a better job of teaching young men and women how to deal with these intolerable thoughts and feelings and memories without having to resort to a drug or to a substance. Now, that's hard work. We've got to teach them how to live in the moment. We've got to teach them breathing exercises. We've got to teach them meditation. We've got to teach them yoga. We've got to teach them skills that, quite frankly, they don't have the patience to want to learn, much less practice. I knew teenagers, for example, that were taught coping skills. They knew these coping skills as well as anybody. They could teach them, but they never practiced them.
Right.
So if you don't practice them, you're not going to get anything out of it.
Right.
So the solution is to teach these kids how to cope with life, how to cope with intolerable thoughts and feelings and memories without necessarily having to get a quick fix through a substance.
How would you go about doing that? What steps would you take in the beginning? Because like you said, we're dealing with kids here.
Yeah.
They don't want to be there.
No.
They definitely don't want to hear anything you have to say. I'm like, here's some ways here's some things that'll help you out. And they're like, no, I'm not trying to.
No, they're not.
How do you get through to them?
Well, I think in the school system, we need to completely change the approach that we use to drug education. All of this stuff about, drugs are bad, drugs are not good for you, drugs are going to harm you. Kids don't believe that stuff.
Right.
But what does work with kids? In my experience, didn't do me any good to tell these young men and women that it was illegal to use marijuana. They didn't care.
Yeah.
Or tell them their grades might drop, or they might not graduate, it might not get to college, might not get a marriage, it might not get married. They didn't care about it because they didn't believe it.
Right.
But what did work with them? What worked with these kids was a neuropsychological approach. Mm-hmm. And by that, I mean, they're very curious about what their brain does, how their brain works. So I would use a neuroscience approach. I would teach them about the brain. I showed them what the brain looked like. I showed them the different areas of the brain and what it was responsible for. So they understood there's a part of the brain that helps me with speech and movement and thinking and abstract reasoning. And then when they got that concept down, I introduced, how do drugs affect that brain? You know about the brain now. Okay, you've learned about the brain. You know how important it is. You know it's developing and it's not fully developed yet. Let's take a look at what drugs do to the brain. Right. And I would show them, for example, the picture of a brain and all the areas and what they were responsible for. And then I'd show them a picture where marijuana attached itself to the brain. And right away, they were able to see, now I understand why my short-term memory is not as good as I want it to be. Now I understand why my motivation isn't very good. So that neuroscience approach, that educational approach, seemed to open up their mind to at least looking at this issue of substance abuse, because they began to see how it affected their brain. That's not something you can do in a one-shot deal in a school. I would start it in the elementary schools where I started just to educate them about the brain.
Right.
So that they understood what the brain was all about, how it was developing. And then as they got into middle school and high school, I would start to introduce how drugs affect the brain. So I would start in elementary school just by teaching them about the brain. As they get older, middle school, high school, I would start to introduce how drugs can change that brain.
Right. And I mean, and that's a great idea, and it's a great hypothetical, but I mean, that's going to take a lot of boots on the ground, so to speak. And
it's going to take the motivation and the willpower to want to change what we're seeing out there in the streets that is affecting our kids.
Right, exactly. And that's not up to the kids. That's not up to them at all. No, unfortunately.
It's up to the adults.
Right. So what, I mean, I guess it kind of falls on the parents a bit too. These are things that the parents could educate their kids on, but
absolutely.
But it also takes the parents having that knowledge, a priori, to be able to even just even be able to do that. And I think a lot of adults don't even really, they don't know how the brain works. Let's be realistic.
No, that's why
they don't care.
That's why I wrote my book.
Right.
I wrote my book to educate parents about adolescent substance abuse. There's a chapter in the book about the neuroscience of addiction, how the brain is affected by drugs. Because you're absolutely right. Parents either assume this isn't going to happen to their kid, or they're paranoid about it and they don't want to discuss it and talk about it, and then they find out one day that they're confronted with it. So they don't know what the warning signs are. So that's why I wrote my book, to educate them about it.
It's funny.
They got to read it first.
It's funny. That's absolutely right. They do have to read it. But the funny thing is, probably a lot of those same parents that are like, oh, it'll never happen to my kid, are the same parents that come home and, have some drinks after work to wind down.
Yeah.
It's the same behaviors, and they're just instilling these things into their children by being, I don't want to say a bad example, but it kind of is. When you watch your parents grow up and equate feeling better to having a drink, well, now it's that dad's relaxed because he's had his, a few beers for the evening. So now we can go talk to, see, it's just, it's such a generation. Yeah, exactly. And it's such a generational thing. And, I guess you just have to be the one to stop, that's really what it is. Like, you have to be cognizant and, have enough present time awareness to be like, okay, that my actions are going to influence the actions of my child in the future, because they're going to associate these things.
Absolutely. They're going to look at you to be the role model. They're going to follow you. If you're doing something, they assume it's okay. So maybe they can do it too.
Right. Right. And not only maybe they can do it, but they're more than likely going to do it because they were taught that it works and it helps. And that's the tricky thing about substance abuse is it if you want to get rid of your bad feelings, it does kind of work. It works for a little while. It almost works.
Well, I sometimes say that
until it doesn't.
Yeah. I usually say, that people don't take drugs because they're stupid. They take drugs because they want to get rid of a feeling that they don't like having.
Right.
That's the bottom line. We have these intolerable thoughts or feelings or memories. We haven't learned how to sit with them in the moment. We just want to get rid of them, and we want to get rid of them right away. And if a teenager is having one of those times and they stumble across something that's going to get rid of it, just like adults, they're going to continue to use it.
Yep. Yep. And then they're going to continue to use it into adulthood and probably pass that on to their children, and so on and so on and so on.
If there's no intervention or there's no treatment, that's very likely to be true.
Yeah, I think we just need better education. I mean, that's really what it comes down to. We just need, better education. People need, children need to be educated, first of all, not only on how drugs affect the brain, but also, like we were just talking about, on coping mechanisms that they can use to, they teach you history in school, they teach you science, they teach you mathematics, but they don't say, hey, sometimes you're going to have these thoughts and feelings, and here's some ways to kind of calm that down a little bit. Here's some things that'll help with that. I think that I think we should have a greater focus on mental health in the educational system, and we just don't have it.
Absolutely. I agree with you. And those skills, those coping skills need to be taught in school, just like history and mathematics and any other course is taught.
I think they're almost more important than a lot of the core curriculum, because if you've got kids that are constantly, overwhelmed with depression and anxiety, it's really probably going to affect the rest of their performance pretty detrimentally.
Absolutely. If a child is struggling with with anxiety or depression or anything else that's troubling to them, absolutely, it's going to affect their academic performance.
Right. How often do you think there's a misdiagnosis for depression when it's, as we were saying, it's probably a good chunk of the time just an inability to cope with life on life's terms. It's all it is.
I think it's both. I think the inability to cope with life leads to depression. They're linked together.
That's what I'm saying.
Yeah, you're right.
It's not necessarily like with a lot of people, I don't think it's a chemical thing. I think a lot of people just have a thinking issue. They just don't know how to quiet their thoughts down and be like, okay, well, or even just recognize that a thought is a thought. A lot of people.
For some people, it is a chemical imbalance that's going on in the
brain. That's true for some people. Yeah, I'm not disputing that at all. But I think for a lot of people, it's not. I think a lot of people just have, that they assume their thoughts are reality. And then that gets out of hand real fast,
Well, and also, I mean, what's the first line of approach? Well, we'll give you a pill. We'll prescribe something to you.
Right. Why is that the first line of approach?
Because that's the quickest.
Right.
That's the one that works the quickest. Instead of taking the time to address somebody's anxiety, for example, by teaching them slow breathing exercises or meditation exercises or any number of other coping skills, and working with them to practice it, because it's not going to work the first time. Okay, it's not going to work maybe the second time. So these coping skills, first of all, have to be taught, and then they have to be practiced and reinforced. But we live in a society that wants a quick fix.
Yeah.
So you go to a doctor and you say, I'm suffering from anxiety, give me a pill.
Right. Well, I mean, we do live in a society that looks for a quick fix. We are an instant gratification society. And the thing with me, like I said, I'm in recovery, and I'm involved in a 12-step program. And I know several people in the program that are on, antidepressants or antipsychotics or, some sort of mood altering, mind altering pharmaceutical. And it's always just been funny to me that that's the direction they go with it. It's like, rather than learning some of these skills that we've been talking about and learning some of these coping mechanisms and putting these things in their toolbox, so to speak, that their solution is the quick fix. It's like, well, but I don't see any differentiation between that and going and smoking a joint, or what I'm saying. What's the difference especially when we're talking about mind altering substances? For
some people, there is a need for them to be on a prescribed medication to stabilize them.
People with you're right. People
that they have an opportunity to learn these other skills. I mean, if you've got somebody that is schizophrenic, for example.
Well, yeah. I mean, we're not talking about schizophrenia. We're talking about depression. Those are two entirely different things.
Well, and the thing about depression is, I mean, it's sort of hit and miss on the medications. But we get back to the real problem here is we want a quick fix. Right. So they go to a doctor, and the doctor might suggest, well, let's try this alternative. Let's try some meditation. Let's try some yoga. Let's try some other coping skill. And the patient says, hell no, I don't want that shit. I want a pill. And if you won't give it to me, I'll go find another doctor.
Right. I mean, but how many doctors do you think just immediately are like, yep, here you go, I'll write you Wellbutrin, Effexor? How many do you think actually take the time and say, well, here, maybe try meditation, or maybe try this? I think there's probably
not very many of them.
Probably not.
But if you go to a psychologist
Right.
or you go to a neuropsychologist, they may take that as the first line of an approach.
Right. Well, for sure a psychologist would. Because they can't, you'd have to be a psychiatrist to prescribe anything.
I mean,
but, and I agree with you. I mean, we just need better education. I don't think just with children. I think that adults need to be better educated on it. But I think that they have to have, just like with anything else, they have to have the desire to want to change. They have to have the desire to want to put some of these things into practice. And, people want the quick fix.
Yep. That's the bottom line for adults and for adolescents. And then when you put that factor in with adolescents and you begin to see how widely these drugs are available, and these kids know that these drugs are available and their low perception of risk, these kids don't think these drugs are harmful. You have what we have out there, which is basically a lot of kids using substances.
Right.
These kids know these drugs are available.
Right. Well, yeah.
When we ask high school seniors, how easy is it for you to get marijuana? Almost 80% of them tell us it's no big deal.
Right.
We ask them, how easy is it for you to get LSD? 30% of high school seniors tell us not a big deal. I know where to get it.
Right. Well, the thing with that is like, it's just such a daunting task. Where do we go from here? What do we do? I just want everyone to have great mental health. It'd just be so, man, the world would be such a better place if everyone wasn't chronically depressed or anxious.
It'd be a great place. But the reality is we've got so many people and including adolescents who are suffering from depression and anxiety and trauma and personality disorders.
Right.
My goal in writing this book was a very simple one. I wanted to educate parents. I wanted them to know, what do you do if you have a kid that you discover is using a substance? What are the warning signs? What are the treatment options? What are the assessments?
Right.
Knowledge is power. And right now, the best thing parents can do is just learn as much as they can about this, regardless of whether their kid is 10 or 12 or 18.
Yeah. 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 I definitely agree with that. And, like you were saying, man, drugs are easy to find, even if you're a high schooler, probably even a middle schooler these days. And one of I think about this a lot. You're familiar with the DARE program?
Yes.
Okay. I was in the DARE program when I was in elementary school, right? And as far as I'm concerned, all they did was teach me what drugs look like, teach me where to get them, teach me how to use them, how they're supposed to be used.
Yep.
I think, and why are we having a drug education program that would teach children all of these different things? Because for sure, that's where I learned a lot of what I know about or knew about drugs before I became an actual drug user. I learned from that program. I would like to see the DARE program replaced with a mental health program that teaches kids about mental health rather than about what drugs, this is what, the acid looks like, and this is what marijuana looks like. And
I would
ridiculous to me. It's just ridiculous to me.
I agree with you. I would restructure the DARE program so that it focused on neuroscience education, what we were talking about earlier, teach kids about their brain and the importance of protecting their brain and how these drugs work in the brain. And then I would add in the coping skills of, how do you deal with anxiety? How do you deal with depression? How do you deal with this? And begin to teach them, some of these coping skills and maybe even practice some of these coping skills. And I would start that very young and I would repeat it every year to reinforce it.
Yeah, I think that's a great idea. And I think it should be implemented immediately.
Yeah, because, man, I think it should start tomorrow.
Yeah, I think it should have started yesterday.
Or years ago when you were there.
Right.
Rather than teaching you about what these drugs are and what they look like, they would have been better off to teach you about how important your brain is, how to protect it, and what these drugs can do to your brain. That you might have paid more attention to.
Right. Yeah, definitely. 100%. I don't doubt that I would have. Because, like you said, that's something that I would have had an interest in. It's something I have an interest in now. But I think children are very curious. So if you start teaching them how the body works, I think that they would have an interest in that. But yeah, I think you've got the right idea. I think you're coming at it from the correct approach. For sure.
Well, it's based on my experience of working with teenagers at Menninger Clinic. I saw what they were not interested in, and I saw what captured their attention. And what captured their attention was the neuroscience education approach to how these drugs work in their brain and what they can do to protect their brain. That's
awesome, man. So, where can people find your book at, first of all? Because I'm interested in actually reading it myself now. I've my girlfriend has two daughters, 12 and 14.
Oh, so she should definitely read it.
They're right in that target area, so I think it would be a good one to have on the shelf.
Sounds like a great gift you could give her.
Yeah, well, it's a great gift I can give them.
Absolutely.
It's not just her. It's really for them.
Yeah, I agree with you. The book is available on Amazon. Mm-hmm. It's entitled The Addicted Child, A Parent's Guide to Adolescent Substance Abuse. Mm-hmm. And there's also a website. It's www.helptheaddictedchild.com. helptheaddictedchild.com. If you go to that website, you can read endorsements, book reviews, a sample chapter. There's a link that will take you to Amazon where you can order the book. Right. There's also a link where people can contact me. So the easiest way is to go to helptheaddictedchild.com, read a little bit about it, click on the link that'll take you to Amazon, and you can order the paperback book.
Cool. Awesome. Well, hey, man, thank you. I really appreciate you taking the time to talk to me today, Richard, and good luck with the book sales. I hope it does very well.
Yeah, well, recommend it to anybody that you think might find it helpful after you take a look at it. It's only about 100 pages because I know parents don't have time to read volumes of information. So I kept it short. But yeah, anybody that you think can benefit from it, please recommend it to them or give them a copy.
Absolutely, I will. Thank you again.
And thank you so much for your participation and for your insight too. I think it was very valuable.
Excellent. Well, have a wonderful evening, and I will hopefully talk to you again in the future.
Anytime.
Big thanks to Richard for being on the show, and sincere thanks to all of you for listening. I really do appreciate it. If you like the show, please do me a favor, go rate, review, and subscribe to it, preferably on Apple Podcasts, but just wherever you get podcasts from. It really doesn't matter. You would be honestly amazed at how hard it is to get people to actually leave a review or a rating or anything of the sort. It's crazy. It takes like 2 seconds. So do me a favor, help a brother out. Anyway, this has been Dharma Junkie. Namaste. You earned it.
Chaos is beautiful.